and welcome to this educational video on the management of snake bites. Now most of the information in this video has been taken from the most up-to-date guidelines from the World Health Organization titled Guidelines for the Management of Snakebite in 2019. I've taken most of this from the management of Southeast Asian snake bites, which is only specific in the types of snakes that you come across, but the World Health Organization does have publications on all of the different areas that might be of interest. In this video, we're going to discuss why snake bites are important, what kind of symptoms you'd expect with the snake bites, what kind of syndromes or groupings we can link the snake bites into, and then how we manage the snake bites. So the World Health Organization states that about 4.5 to 5.4 million people get bitten by snakes annually, which is a huge number. Of this, 1.8 to 2.7 million people develop clinical illness, i.e. need to go to hospital, and between 81,000 and 138,000 die from the complications. So to put that in perspective, 1 in 40 people die from the complications of snake bites, which is really high mortality. This is kind of worst in India, where it's estimated that 1 million Indians have died over the past 20 years. And there's a massive difference in the resources between the healthcare systems. For example, in Australia, every year there's only about 550 hospitalizations. So the first step in managing a snake bite is knowing that the area that you're working in and what snakes are indigenous to there. So obviously you need to look at your kind of local area and the local distribution of the snakes, but I'm just going to cover the most common snakes in Australia as it's an area of interest of mine. So the most common snakes there are eastern and western brown snakes, with westerns having much more potent venom but being a lot rarer. And they're able to kill a human within about 1 hour due to their neurotoxic venom, and it also contains anticoagulant compounds. And it's really important to know kind of the basic types of venom that the common snakes in the area have, because the management of a snake that has anticoagulant venom will be very different to the management of a snake that has neurotoxic venom. The second most common snake is the mainland tiger snake, which contains neurotoxic venom. And the third most common is the coastal taipan, which contains mainly anticoagulant toxin, and this can kill a human in under 30 minutes. Just another example, the most common snakes in India are the krait and the king cobra. Time to move on to what symptoms you can expect with a snake bite. And the first symptoms that I'll mention, which is important not to overlook, although it sounds a little bit wishy-washy, is there is a lot of anxiety around snake bites. Obviously, there's a lot of reports of people dying. I think if you're bitten by a venomous snake, you automatically assume that you're on death's door. And this anxiety can lead to a lot of heightened symptoms. So it can make any symptoms that are present a lot worse, and it can cause new symptoms. So if you're hyperventilating, you might cause paresthesia and tingling in your fingers. The anxiety might cause you to have tachycardia or high blood pressure. And it's often been reported that signs and symptoms can appear even when no venom has been injected, just because of the act of being bitten by a snake. So the first very obvious symptom with a snake bite is the localized swelling. So there'll be some bite marks. It's important to note how painful the local area is, because bites by kraits and sea snakes can be virtually painless and cause very negligible local swelling. And it's also important to note that just because there is very little local swelling or pain, it shouldn't be a differentiator for how serious it is clinically, because kraits and sea snakes can both be very, very poisonous. And even though they don't cause local swelling, they can still cause great systemic effects. So local swelling isn't a good indicator of kind of the overall seriousness. There's also kind of the general symptoms of nausea, vomiting, malaise, abdominal pain, weakness, and drowsiness, which are a bit non-specific. Cardiovascular symptoms, so shock and collapse, dizziness, visual disturbances, arrhythmias. So basically the point I'm getting at here is that there's a lot of systemic symptoms. If you've got a neurotoxic venom, the neurological symptoms are generalized paralysis, respiratory paralysis, ptosis, so drooping of the eyelids, paresthesia, aphonia, so being unable to produce speech, regurgitation, and difficulty swallowing. And there's also something called the broken neck sign, which is when you get flaccid neck muscles and they're unable to contract, so your neck looks as though it's broken. So that's the neurotoxic venom. What about the anticoagulant type? So you can get any kind of, if you just think of a clotting disorder in general, you can get petechiae, intra-abdominal bleeding. Kind of one of the most obvious signs is prolonged bleeding either from the fang marks or from the venipuncture site. You want to watch out for things like neck rigidity and mucosal bleeding if you're suspecting an anticoagulant effect, just because it greatly increases the risk of a subarachnoid hemorrhage, especially important if there's any history of trauma to the head at the time. Something that's very specific to anticoagulant effect of snake bites is conjunctival chemosis, which is basically bleeding into your eyeball, and the image on screen here kind of illustrates that perfectly well. Something very specific to anticoagulant effects of snake bites. And the final point to mention about symptoms is the kind of more toxic venoms can cause rhabdomyolysis, which is the posh word for skeletal muscle breakdown. So that starts with kind of pain on passive stretching of the muscles and stiffness of the muscles. So again, that's a really important thing to look for in your examination. And as you'll know, rhabdomyolysis can eventually lead to kind of AKI, myoglobinuria, so protein in your urine, and hyperkalemia. So again, just to summarize the symptoms, don't overlook anxiety. Local swelling is worth noting, but shouldn't kind of be a marker of clinical seriousness. And there's a lot of systemic symptoms which will point you in the direction of whether you think this is a neurotoxic or an anticoagulant type of venom. Now, based on these symptoms, NICE gives some syndromes that you can group these people into. And this is really useful in identifying which kind of snake it is. So this is based on the amount of local envenoming, whether there's bleeding or clotting disturbances, or whether there's more neurological disturbances. I won't labor the point and go through all of these, but there's a link down below to the NICE guidelines, and I'll also leave these up on the screen if you want to pause the video to write these down if that's of use to you. Just before we move on to the management of snake bites, I'd like to have a quick look at what kind of questions you need to be asking them, what you need to note in your examination, and any investigations that are pertinent in a snake bite. So, key questions as soon as they get into hospital. Where were you bitten, obviously? Do you have any images or description of the snake? And that needs to be sent straight away to a specialist who can help you to identify what kind of a snake it is to help direct your antivenom treatment. And how are you feeling now? So try and elicit all the symptoms, obviously. In terms of the examination, your first point of call will be examining the area that was bitten, the extent of the tenderness, the swelling, if the lymph nodes are tender or swollen, and if there's any early signs of necrosis, for example, blistering or changes in the color of the skin. You want to do the basic vital signs, and then you want to do a systemic exam for the previously mentioned neurological and anticoagulant symptoms. In terms of investigations, it's basically going along the lines of the same thing. So you want to do a clotting screen and an INR, a D-dimer, again just looking at clotting disorders. You can be pro-coagulopathic as well. Do a full blood count to check for hemolysis or leukocytosis. You want to do U and E's, mainly because of the risk of rhabdomyolysis, the chance for hyperkalemia, and you also want to do a creatinine. You could do a CK level to check for muscle damage. You want to do a urine dipstick to check if there's any blood, any myoglobin or any protein in the urine. And if you're suspecting a kind of hemorrhagic picture, you might want to do a chest x-ray if you're suspecting pulmonary edema. Of snake bites can be divided into two parts. So the first is kind of the pre-hospital management. And as we previously mentioned, anxiety is a really important factor in kind of the outcome of a patient with snake bites. So the first thing you need to do is reassure the patient that you're going to manage it effectively and get them to hospital in the shortest time possible. Secondly, and really importantly, I when researching this expected that a tourniquet would be the next line, but apparently tourniquets can greatly increase the risk of avascular necrosis of the limb. So it's better to apply a tight bandaging starting distally that's tight enough to stop the lymphatic drainage, but loose enough to allow a continue of the blood flow and reduce the risk of limb necrosis. And finally, whilst you're getting the patient to hospital as quickly as possible, it's important to immobilize the patient. This is particularly important and basically the only treatment if a patient is bitten on the head or the neck or the body. Just immobilize them as much as possible to reduce the spread of the venom. So when you get into hospital, you need to do a rapid clinical assessment, and your management is going to be based purely on how unwell the patient is. So of course, if they're really unwell, the first thing you're going to need to do is do an A to E assessment. If there are any signs that the airway is compromised, then you're going to need to intubate the patient, particularly with an eye gel, or perhaps even propofol and forced intubation if there's any signs of kind of respiratory arrest. If that's not the case, then you need to do urgent fluid resuscitation if the patient is shocked, gain IV access, and then you need to think about initiating antivenom treatment. It's also important to note here if there is any tourniquet or bandaging in place, be very wary in removing this before you've administered the antivenom or before resuscitation facilities are available, because that can commonly be the main thing stopping kind of the onset of systemic symptoms. So be really careful in removing tourniquets or bandaging if it's in place. The antivenom is a recombinant immunoglobulin that comes commonly from sheep or from pigs. The selection of the antivenom, there's multiple different types which are specific to suspected species. So this is where you use those syndromes that I previously briefly mentioned to kind of decide which treatment of antivenom you give. So some will only cover vipers, whereas others will only cover cobras. And it's just important to emphasize that you really want to get a good history of what the snake looked like, if there's any pictures, even if they've killed the snake and brought it in, and that can really guide your antivenom treatment. So antivenom is indicated when, and this is just a list, there are hemostatic abnormalities, there's paralysis, there's cardiovascular abnormalities, including shock. There's AKI or symptoms of an AKI, or there's swelling involving at least half of the bitten limb. You've done the primary management of the patient, you want to treat their symptoms and their syndrome. So if their syndrome is mainly anticoagulant, then hemostatic disturbances are usually corrected purely by the antivenom. If there's persistent severe bleeding, or the patient needs to rapidly go to theatre, for example, for debridement, then the reversal of the hemostatic disturbances can be accelerated with blood products. But there's no indication for any other kind of, for example, any other kind of management. On the other hand, if they've got mainly neuromuscular disturbances like ptosis or respiratory depression, there's a trial of anticholinesterase inhibitors. So you can give atropine sulfate IV firstly, and then you can follow this up with IM neostigmine. The amount of which you give is within your local guidelines or can be found on the World Health Organization website. You observe them for about 10 to 60 minutes after this, and you're hoping to see a disappearance of the ptosis or a greatly improved ventilatory capacity. If not, then you might need to give a further dose. And finally, as I mentioned, you might need to do urgent surgical debridement and skin grafting if there's necrotic tissue. If there is necrotic tissue, there's a high risk of infection. So you also want to think about giving your patient a tetanus booster and prompt antibiotic treatment, and that's because of the risk of infection from the snake's oral tract. So just to complete this video, I'm going to leave some questions at the end which you can answer in your own time to reflect on how much you've learned during the video.